we work with kids from birth all the way up to 3 years of age, so it is very, very young children. And I think what really sets us apart is, first and foremost, that we are working with different providers all in one. So it's collaborating with a speech and language pathologist, and as well as an occupational therapist, and myself as the pediatric psychologist. So I think the benefit is that families are getting all these disciplines and getting that child evaluated in those different domains, those different areas, in one assessment. And that assessment is also integrated, so the parents are provided one document with the reports and the findings. So oftentimes parents might go, let's say for example their child's having some language delay, so they might go to a speech and language pathologist, and they might start working with the speech and language pathologist, but maybe that child's also having some fine motor difficulties, and so now then they have to go to an occupational therapist. And so they're having multiple providers in multiple areas. They're doing drop off and pick up. And I think that the value in our multidisciplinary evaluation is that it's all in one. So the parents need to go to one location. They're getting the findings in all these different domains, and they're getting one full comprehensive intervention plan, if that's the case and that's what's needed for that child.
From all those areas. Yes, that's awesome. And we know that that's a benefit here in Miami with the traffic we have.
Absolutely.
Give us some insight about what a normal testing session would be like with these kind of kids and the three professionals.
Of course. So because the child's so young, it's very play-based.
Okay.
So it's very much looking at certain developmental milestones in their cognitive development, in their speech and language, and in their gross and fine motor skills. But it's all naturalistic in their play skills. So for example, it might be looking at how well can they assemble a puzzle. Okay. How well can they walk across a line on the floor? What are the sounds and the words and the vocalizations that they're using? How do they direct our attention? How do they get their needs met? So it's very naturalistic, it's very play-based, and it's very fun. A lot of the kids end up enjoying a lot of the attention that they're getting. But not only that, the family are also in the room, and they're also there to help the child be comfortable, but also to observe them and to give us some feedback if we have some questions or other things that we might need to get information about. So we're all working together in one environment, but it's very much fun, it's very play-based, and again, usually the kids enjoy all the attention.
Is this the kind of evaluation that, say, a parent with the unanswered question of, is my child in the autism spectrum, is this the kind of evaluation that they should be seeking? Or is there some guidance you can give those families?
Certainly. I mean, if they are within the age range, so again from birth to 3 years of age, and their child is lagging in certain areas of their development, and they're concerned, then this would be an evaluation that could look at those areas, but not just their cognitive development or their speech development, but also their social development. So if there is that concern, then we can provide an additional assessment that would then measure the symptoms and characteristics related to an autism spectrum disorder. So sometimes families might come in, that might be the primary concern. Other times families might come in and they might just notice that, my kid's not really talking as much, or they were having a lot of words, but now they're not really expressing those words anymore. Let's look into this a little bit more in depth. And so if autism is a concern, then we do provide a specific assessment that does look at those skills, and that would then either provide a diagnosis or would then guide them that, this is not really the case, but it might be X, Y, and Z.